Welcome to the Home Health Gap Collaborative Informational Webinar. My name is James and I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question and answer session. During the question and answer session, if you have a question, please press star 1 on your phone. I'd now like to turn the call over to Janelle Shearer. Janelle, you may begin.
Thank you. Hello, everybody. This is Janelle from Stratus Health, the Minnesota Quality Improvement Organization that is part of the Lake Superior Quality Innovation Network, or Lake Superior QUIN, under the Centers for Medicare and Medicaid Services Quality Innovation Program. Welcome to this webinar today. This webinar is presented in collaboration with Stratus Health, Minnesota Home Care Association, and specifically the Minnesota Home Care Association's Clinical Quality Team, and Minnesota Hospital Association. Here with me today is Jenna Kornberg, who will be monitoring the chat, which is on the right side of your screen if you want to use that, and will also be running our polling questions. This webinar is an informational one about a new collaborative that we will be offering you to join. At the end of the webinar, you will be able to sign up to participate in the collaborative via a screen that will pop up on your computer before you sign out. If you wanted handouts, like hard copy handouts for this webinar, Jenna has put the link in the chat. You also could have uploaded them right before you signed on today. So our objectives today are to discuss the analysis findings for home health referrals post-hospital discharge in Minnesota, to identify the home health referral uptake gap and the effects, and to understand how to participate in a statewide virtual collaborative to reduce the home health gap. So before we get going too far, I'd like to know what type of organizations are on the call today. So I'll have Jenna pull up the polling question, and I'll read it first. The next slide, please. The question is, what type of organization are you representing? So the choices are home health agency, hospital, skilled nursing facility, or other. You have 30 seconds. So we should be seeing our results pretty soon. Did that show up for the folks as well? So these are the results? Yep. Okay, so we have 32 people on the line so far. We have 16 from home health agencies, 4 from hospitals, and 2 from skilled nursing facilities, any other, and 5 from others. So I'm hoping that we'll have more folks that are able to join the call as the time gets going, too. We did have about 75 that had registered earlier this week. Okay, great. So many of you are participating in the Coordination of Care initiative, and I want to give a little background about it before getting into the details about the home health gap that has been discovered. The Coordination of Care initiative is a community-based approach to reducing the 30-day hospital readmission rate by bringing community partners together to improve care transitions and care coordination as people move across the continuum of care, including being at home in the community. The goals of the initiative are to improve quality of care for Medicare beneficiaries who transition among care settings, and honestly, it's not just for Medicare beneficiaries, it's all patients. As we know, you treat them all the same. We want to, and this is a national goal, reduce the 30-day hospital readmission rate and admission rates by 20% by 2019. We want to increase the number of days that people are in their own homes, and then to establish sustainable, transferable transition practices across the continuum of care. This initiative started in the fall of 2014, and it concludes July of 2019. So we have a little over a year to go on the initiative. For those of you that are participating in it, this map will look familiar. We currently have 10 communities in Minnesota. So the map is a picture of where these communities are. The types of organizations that participate in these communities include hospitals, nursing homes, home health agencies, assisted living facilities, hospice programs, clinics. Those would be the main traditional home health organizations, but then there are many other organizations involved who care about people being safe and well at home, including parish nursing, retail agents, retail pharmacies, CME providers, trade organizations, payers. We have the Department of Health, higher education, and others. If I forgot your organization, please put it in the chat if there are other organization types that I didn't mention. People and organizations in these communities are working on a variety of approaches to prevent admissions and readmissions. And the next few slides will show some data for the efforts. So this first slide is looking at the readmissions rates for the Medicare fee-for-service beneficiaries at 3 different levels. The gray line is the state level, so all the fee-for-service beneficiaries in Minnesota. The lime green is the national, and then the blue is the community. So if you remember the map, what we're looking at are the claims data from the Medicare beneficiaries, fee-for-service beneficiaries that reside in each of those communities, which is why their boundaries are jagged, because it's based on zip codes. So looking at this one, we're looking at 30-day readmissions. It goes by quarter, so every quarter there's a new set of data. Down is better, so lower is better. This is showing that overall in the state of Minnesota, we are lower or better than the nation. This community that we're looking at, which happens to be West Metro, is higher or worse than the state and the nation. The trend line, the dotted line, is the community's trend line. So you can see it's going down for that community, and same with the state and nation, but ever so slow. We're kind of stagnant, both nationally and statewide, which is why we've been digging into the data more deeply. So the next slide shows a comparison of all 10 communities. So I know it's kind of busy, it's color-coded. So if you're in a community, you pick your color and see where you're at. We're comparing it to the state, which is hard to see, but it's a gray line with a black, or maybe it's more of a black line with a dot, and then the nation is the dotted. So you can see how all the communities look when we're trending for readmissions. Some are getting worse, some are getting better. Lower is better. This graph is comparing how each community is doing in relation to meeting the CMS goal for that community for the initiative. So the goal that CMS has put out for the communities is a 10% relative improvement goal, improvement from their baseline. So looking at this graph, each community has 2 bars. The blue bar is their baseline, and the baselines do vary in time point depending on when a community started. The yellow bar is the most current data, which in this case is quarter 2 of 16 through quarter 1 of 17, so it's a year's worth of data. And then the red line is the goal for CMS, so the 10% relative improvement rate for that community. The remeasurement for this initiative isn't reflected in this graph. The remeasurement time period is quarter 4 of 17, so starting October of 2017 through quarter 3 of 2018, so through September of next year. So what's happening right now in our state will affect our remeasurement for this project with CMS. So at Stratus Health, we've been digging into the data to see what areas we can help you all address to reduce our rates even more. Many of you are participating with us on the heart failure webinar series that we did last summer and fall, as that has been a top reason for readmissions in our state. We also just started a sepsis webinar series, and that was earlier today, as that condition also has a high readmission rate for us. Laura, our team analyst, also looked at the use of home health and noted a gap. And so I've laid out our home health gap concern into the SBAR format. Most of you are probably familiar with that. So we'll use the acronyms SBAR, so Situation, Background, Assessment, and Recommendation. What we found is that there is a huge gap between the number of patients referred to home health and the number who actually receive services. So that's one gap. The second one is those patients that are referred but do not receive home health services have a significant higher readmission rate. So a little bit of the background of the problem. Next slide, please. So these are some slides that Laura developed for us. This slide shows that in calendar year 2016, 11,403 Medicare fee-for-service beneficiaries in Minnesota had a home health discharge status code. So what that means is when a hospital discharges a patient to home health or any other setting, they put in a certain code in their claim. So that many patients had a home health code in their claim, meaning the hospital referred them to home health services after they were discharged. And then we looked at which of these patients had a home health claim within 5 days of hospital discharge. And that's where we split them out into two colors. So of those 11,000, 5,264 people, or 54%, had a home health claim within 5 days of hospital discharge, meaning they received home health services. The blue part of this graph shows that 6,139 beneficiaries had no home health claim, thus not receiving home health services from a Medicare certified agency. So 46% there. So that's one gap. When we look at the national numbers, I'm going to call it uptake, when a person receives home health services. So they had a referral, and now they have a claim that said they received services. We're going to call that uptake. Nationally, the uptake is a little over 71%. So in Minnesota, we're at 54%. Nationally, it's 71%. Then we looked at the 30-day readmission rates for the two groups. So those that had a home health claim within 5 days, which is the yellow bar, and those that had no home health claim within 5 days of hospital discharge, the blue bar. So here you can see those that had home health claim and received services had a 17.8% 30-day readmission rate. Looking at that black dotted line across, that's close to our overall Minnesota statewide readmission average right now, 17.7%. Those folks that had a referral but didn't receive home health, they had a 27% 30-day readmission, so much higher than those that actually received home health services. So that's the gap we're trying to narrow as well. This slide is comparing the two groups, those that received home health and those that didn't within our state, looking at the percentage of readmissions by the day after discharge from the hospital. So, for example, you look at number 1 there at the bottom, yellow, those that had home health services had a low percent of readmissions. If they didn't have home health, the blue bar is really high. And that could be one of the issues. Maybe they weren't admitted yet. They went right back to the hospital. And the gray bar is just used for reference looking at all readmissions in our state. This is the last graph. So we wanted also to know, well, does it vary by location in our state? So we looked at all 10 communities because one thought we had was, well, there is a lack of access to home health services in some areas, particularly in our more rural areas part of the state. So looking at this graph, it could be part of it. As we see, some of the rural areas have a lower uptake, so in this case, higher is better. We're looking at uptake here. But even our highest community, which is Ridgeview area, having a 66.1%, is still less than the national average of 71.4%. All right, so SBAR, situation, background. Now we're into assessment for our talk today. So, and I want to involve you. So we have a choice of questions, and I'm just going to explain it a little bit because it might be confusing. What we want to know is, does your organization track the number of home health referrals that actually receive services? So if you're a home health agency, you answer A or B. If you're a hospital, you answer C or D. If you are other, like nursing home or assisted living, you answer E or F. If it's not applicable for your organization, you don't give or receive referrals, please select G. And Jenna has opened the poll, and you have 30 seconds. And we're just waiting for the poll to finish tabulating. Okay, so for home health, it looks like 16 of the 47 are tracking. For hospitals, it looks like just one of, what's the denominator there? 1. And 3 not, and then we have other, 1 yes other, 1 no other, and then 6 does not apply. Thank you. So it looks like home health, of those on the call, home health is tracking at a higher rate, not so much at the hospital level at this point. Next question, what percentage do you think actually receive home health services? So if you're a referrer like a hospital or a skilled nursing facility, what would you think would be the actual uptake of your referrals? And then home health agencies, if you're receiving referrals, what would you say is your uptake of actual receipt? Poll is open. Okay, so for this one, low numbers, say 0 to 25, 9%. From 25 to 50%, people are saying about the 7%, 3 out of 46. 51 to 75, bigger, and then 75 to 100 is 17% of the respondents. So we have 11% that it didn't apply to their organization. Okay, great. Now, we want to have a time for discussion. So you can either press #1, or you can list things in the chat. The question is, what reasons are you aware of that contribute to a home health referral that does not result in home health services? So James, I'll have you explain how to get into the queue to respond.
Okay, sure. If you have a question or comment, press *1 on your touchtone phone. If you wish to be removed from the question queue, press the # sign or the # key. If you're using a speakerphone, you may need to pick up the handset first before pressing the numbers. So once again, if you have a question or a comment, press *1 on your phone.
Okay, Jenna, I'll have you go ahead and just kind of review what folks are saying in the chat.
We have a few that's saying complying with homebound status. They don't meet homebound requirements. The patient refuses. not asking if the patient has home health services. They're not Medicare appropriate. Looks like a lot of patients refusing care, not homebound patient refusal. No education regarding home care.
I see one that says admitted to hospital prior to admission. Is there anyone on the phone line that has offered to share?
No, I'm afraid not.
Okay. That's the nice thing about chat. People can just type in what they want to say. I'll just wait another second or so if anyone else has same or different ideas. I originally brought this to the Minnesota Clinical Quality Team, Minnesota Home Care's Clinical Quality Team back in December, and had sent out a survey to the home health agencies in the West Metro and heard back from a few of those. Some of the things that they mentioned between them and the Clinical Quality Team included client refusing services, they're not homebound, being hospitalized before the home health admission, home health staff capacity. I don't think we had that one in our chat. Can't get a hold of the patient to schedule the admit, or they use another home health agency. Anything come since we opened up the lines?
Nothing over the phone.
Okay. Oh yeah, coordinating home health takes too long. Have a claim with another agency. Non-Medicare patient insurance has limited network. So you can see there's lots of different issues. You know, when we first thought about this problem, it seemed like, oh, there's probably a simple answer, but as we're learning more and more, not. And I think there are many issues on both sides, the referral and the acceptance of home health. So on the patient and the home health agency side. Okay, our next question is it a priority for your organization to address the home health gap? So the answer is yes, no, not at this time, or it doesn't apply. And the poll is opened. Okay, so it looks like the majority of folks say yes. This is a priority for our organization to address, so that's great. Thank you. So the next question is, what is your organization doing to address the gap? So the first choice is working on our own processes, working with our hospital home health partners, other, nothing, or does not apply. And the poll is open. Okay, and the results of the poll, it looks like 10 are working on own processes and 13 are working in a partnership with hospital home health partners. Let's see, is there anything else for, okay, nothing for 7 and an A for 1. And I think I'd like to just ask you to put in the chat now, if you're working on something, whether it's in your own processes or working with a hospital home health partnership, can you just briefly describe what you're doing? Or you can go ahead, we can open up the lines too if people are comfortable talking. And that was star 1. Okay, Jenna, some things that you're seeing there.
Yeah, it looks like asking detailed questions when they receive referrals, working on handoffs between the staff and home health agency, working with home health and access to PCPs for call-in situations, case managers helping members get home care if needed, liaisons and warm handoffs, implementing a handoff report from referral sources. Looks like one has a 7-day readmission prevention program. We have another, we review all of our non-admission reasons and determine what processes we need to adjust to ensure that we are able to take on more of the clients. They also provide education to the teams based on the results. Tracking awareness of hospitalizations. When does the hospital know we're involved in trying to add home care to the care team? Working with hospital care managers on appropriate referrals.
Great. Thank you, everybody, for sharing what you're doing. Well, here's another one.
Starting a transition to home program for heart failure patients.
So they do a complimentary one-time nurse visit. Great. A lot of great ideas. So thanks, everybody, for sharing that. So the data and the issues that we just discussed, as I mentioned before, were shared with the Minnesota Home Care Association's clinical quality team in December. They had lots of ideas and issues from a home health point of view, but felt that we needed the viewpoint of others, such as hospitals, nursing homes, patients, and families. The clinical quality team was excited to develop a collaborative partnership with referring organizations and home health agencies to address the issues of the home health gap. So thanks to all of you on the clinical quality team for being a part of that and really helping us get this started. So the next slide is talking a little bit about this collaborative, and this is probably one of the reasons you joined the webinar today. It's like, well, what is this all about? So it is a statewide home health gap collaborative. Who we want folks from home health agencies, hospitals, and others interested, such as nursing homes, assisted living, or those that refer to home health services, including patients and families, because I think it's important to understand the thoughts and reasons and issues that patients and families have. So if you have patients and families that you work with, I would ask that you include those. And then the how, it's going to be a virtual format using work groups. So that means no in-person meetings, no driving, 3 hours for a 2-hour meeting and then back home. So we plan on doing this virtual meeting over the phone and probably using some formats such as Skype for Business. When? It's going to start now. We want to make an impact soon. So the goals for the initiative are these, and these were developed by the clinical quality team at the Home Care Association. The Minnesota Hospital Association is also working with us on this, and Stratus Health. So the goals for the initiative are to identify issues and barriers for receipt of home health services. We want to discover best practices at hospitals and home health agencies on collaborative approaches to increasing the acceptance and use of home health services following a hospitalization. To develop best practice tools for spread throughout the state to increase the uptake of home health services and reduced readmissions. So those are the goals. The next steps then are to sign up to participate. And we would like to offer multiple people from organizations can participate. So we envision, this virtual collaborative being a group of folks in some work groups addressing issues. So to figure out what the issues are, we are offering 2 brainstorming sessions where the whole goal of that meeting is to identify the issues and then prioritize them. So there will be 2 different times, and you would select whichever time is most convenient to you. The next slide is going to tell you when it is, but they're in March. So once in the morning, once in the afternoon. And go back to the previous slide again. Thanks, Jenna. And then once the issues are prioritized for each of those 2 brainstorming sessions, we will form work groups. So together we'll have a joint call between 2 brainstorming sessions, talk about the issues that were prioritized, then select the issues we want to address. And then we will form some virtual work groups that will address those issues. And the work groups will be led by Stratus Health and the clinical quality team and the Minnesota Hospital Association. So when we get down to that part, you'll be able to be working with one of us. And when we get to the work group part, we also want it to be a mixture. So not just hospitals in one and home health and nursing homes or whatever in another, but we want the voice of both kind of the referral and the receiving referrals in the work group. And then we'll share, the resources will be shared broadly statewide. Next slide. So now you can see these will be the 2 brainstorming sessions coming up in a couple of weeks. And then after that, we'll schedule a call for everyone to then select the issues that we want to work on and form our work groups. So after the webinar today, I should say, as you close out on the webinar, there will be a pop-up on your screen that will allow you to participate in the initiative. There will be first 3 questions, seeing how you felt we met the objectives of this webinar, and then there will be a question saying, do you want to participate? Does your organization want to? And then if your answer is yes, we'll ask things like the name of your organization, the type of organization, the city you're located in, and then who the primary contact person would be and their information. So after the webinar today, I will send an email either today or tomorrow to those that indicated they'd like to participate with a link to register for those 2 brainstorming sessions, and that will include the call-in numbers. So now I'd like to open it up for questions either over the phone or in the chat that you have about the collaborative or anything else that we talked about today.
And once again, as a reminder, to ask a question over the phone, press *1.
And just kind of to get things going, if you're interested, just put a yes in there so we kind of have an idea if folks are interested in working on this. We're really excited here at Stratus Health and with MHA and MHCA to be working on this. This will be the first time, at least I've led a total virtual collaborative, so we're really excited about that. Oh, good. We're seeing people that are interested. Great. That's awesome. And, since this is kind of a new thing, it's going to evolve, and so we don't have the answers for sure. And we want to learn from your experience and expertise. So if you are a home health agency or a nursing facility or a hospital and you have had good results in your uptake, we want to learn from you. We will also be looking into the literature to see what is out there in the evidence that supports increased use of home health, and also to colleagues in our quality improvement organization world. And you don't have to be a hospital, home health, nursing home to participate. We would love it if payers were at the table as well, and others. Anyone have questions?
I have a question from Wendy.
Great, thanks.
From Cindy. I'm with Wendy. I'm wondering if with these statistics, if it's been looked at, the success of the home care referral based on if the hospital has a licensed home care or a home care license, and those that make referrals that don't have a home care referral or license.
Okay, so I'm going to repeat the question, and I hope I have it right, Wendy. But I think you're asking, did we look at the data to see if the hospital had their own home health agency, and if perhaps those have higher referrals?
Correct.
Okay.
Cindy, I'm with Cindy.
Oh, okay. Okay, thanks, Cindy. The answer to that is no, we haven't looked at that specifically, although I will say, since Stratus Health is the quality improvement organization for Minnesota, we have access to the Medicare data, and we have been able to look at hospitals, and we just looked at West Metro was all, but to see what the uptake of hospitals are. And so we didn't dig into it deep enough to say, well, do they have their own home health agency, and is that where they're going? We didn't look at that. But we did see big variations in hospitals in the West Metro, anywhere from in the 30s to up to, if I remember right, around 80% of uptake. But great question. And I'm glad you brought that up, because we want home health agencies in both work groups that are part of systems and also privately owned or independent home health as well, not hospital-based, I guess. Other questions? All right, well, seeing there are none, and I don't see any more in the chat box, I would just like to say thank you to everybody for taking the time out of your busy day to listen in on this informational webinar, and I hope that you all are interested in participating. So when you close out, or does it pop up now, Jenna?
When they leave the event.
Okay, when you leave the event, you'll have this little pop-up, 3 short questions on the objective, but then it's your chance to sign up to participate. Once you sign up, you'll get an email from me, Janelle, here at Stratus Health, giving you information about the 2 brainstorming sessions. So that will be your first chance to participate.
And I'm also putting that link in the chat box.
Thanks, Jenna. All right, so that concludes our webinar today. Thanks again, everybody, and I hope to see you virtually on this Home Health Gap Collaborative.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.